Hello, everyone. Good evening to everyone who is tuning in from Australia, and guten Morgen to our German audience. We are delighted that so many of you have already decided to join us in today's industry webinar on the topic of health IT. My name is Hannah, and I am a market entry consultant with the German-Australian Chamber of Industry and Commerce, and I will be moderating today's webinar that we are hosting in cooperation with our partner organization, Germany Trade and Invest, Germany's economic development agency. Before we get started, I just want to share some administrative items with you. After finishing all presentations, we will conclude the webinar with a Q&A session. So I'm really encouraging you to share all your questions via the Q&A function, which is located at the bottom of your screen. Just post your questions there, and do also let us know which speaker they are for, and then we will get to them at the end of all presentations. Also, I've got my colleague Matthias administrating the back end, so should there be any technical issues for you, please do let us know via the chat function, which is also located at the bottom of your screen. So today I am honored to introduce our incredibly interesting and talented panel of speakers to you, who will be talking about the digitalization of the healthcare space, both in Germany and Australia. Especially in the light of the corona pandemic, the necessity of bringing together health and digital applications has become more and more evident. Our speakers will talk about the market for digital health applications, where in Germany, a Digital Healthcare Act has recently been introduced, opening up opportunities for health apps being available on prescription. We will then hear about real-life applications and software systems that are delivering great outcomes for both businesses and users. So here with us today are Heiko Stumpf, who is the director at Germany Trade and Invest for Australia and New Zealand. After assisting foreign investors with legal matters in Berlin, Heiko joined Germany Trade and Invest in 2012, and he has been working for the Sydney branch since 2018. He's reporting on business opportunity in Australia and New Zealand for German companies, and this includes market reports about various sectors, including healthcare. Heiko will be followed by Dr. Nicholas Nikoloudis, who is an innovation leader at SAP. Nick has a PhD in computer science from Monash University and has been architecting and developing market-leading software applications for the past 20 years. He worked with multiple startup and multinational organizations, and his research has led to numerous publications, patents, and awards in exposing web services from business applications to data mining and processing on mobile devices. Last but not least, we have Sylvia Pfeiffer with us. She is a co-founder and CEO of CoView, a telehealth software platform for healthcare businesses. Originally from Germany, Sylvia has more than 20 years of experience with web video businesses and has previously worked with Google, Mozilla, Niktar, and CSIRO. She also has a PhD in computer science and published several books on HTML5 video, and also one book about setting up video consultations for healthcare businesses. Also, Sylvia was recently announced as the winner for the 2020 Founder of the Year at the National Women in Digital Awards. So congratulations, Sylvia, on that. Thank you all for being here and sharing your insights with us. And now, without further ado, I'm handing the word over to our first speaker, Heiko Stumpf from GTAI.
Thank you very much, Hannah, for the introduction, and welcome to all participants who are joining us today. In my presentation, I want to give an overview about the digital health market in Germany. I quickly have to go back to the start of this presentation, and especially as Hannah mentioned, we have a new legal framework that offers interesting opportunities also for Australian companies. But before I go into the details of this new legal framework, I want to start with a more general overview about the healthcare market in Germany. And healthcare is one of our largest growth sectors. And over the past 10 years, the healthcare industry grew by an average of 4% per year. And the annual healthcare expenditure now amounts to a massive 390 billion euro. So that's already more than 1 billion euro per day. The GDP contribution of 11.7% is more than double than even our re-owned car industry, which only contributes 4.7%. This just underlines how big and important the healthcare industry really is. And while the German economy is in general very export-oriented, it's important to point out that Germany is also Europe's largest importer. So last year in 2019, the German healthcare industry imported goods worth almost 110 billion euro. That's the equivalent of 180 billion Australian dollars. So this just underlines the market potential that exists. And if you again look at the developments of the past 10 years, the imports of the German healthcare sector grew by an average of 6%. So there's a huge market for Australian companies to tap into. As potential customers for healthcare companies, there are around 2,000, sorry, I have one slide here. Okay, yeah. First, I want to say the one reason for the strength of the German healthcare system is the almost universal health insurance coverage. This is because health insurance is mandatory in Germany. That's why 72 million people, or almost 90% of the population, are members of the statutory national health insurance. And another 9 million people, or around 10% of the population, have private health insurance. This mainly consists of people who are self-employed or high income earners. Then when we look at potential customers, there are around about 2,000 hospitals with 500,000 beds. And in the coming years, these hospitals will receive a major funding boost. This is because of the so-called Future Hospital program, which is a major component of the stimulus package of the German government to combat the economic effects of the COVID-19 pandemic. And this Future Hospital program is funded with 3 billion euro. And this money will be used to support the upgrade of the digital infrastructure of hospitals. So some focus points are, for example, telemedicine, IT systems, cybersecurity, but also robotics. Investments like this are required because the healthcare system in Germany also faces some major challenges. Like in other developed countries, the society in Germany is aging, and already more than 17 million people aged over 65 live in Germany. That's 21% of the population. And in international comparison, that's already very high. If you compare it, for example, with Australia, the population share of people aged over 65 is only around 16%. And for Germany, it's projected that the population share of people aged over 65 will increase to around about 26% by 2030. And at the same time, we see an increase in lifestyle-related diseases and a rise in numbers of people suffering from multiple chronic conditions. So the demand for healthcare is ever increasing. And one solution to meet this demand is to invest in digital health. So the digital health market in Germany is experiencing strong growth and projected to reach a market volume of 38 billion euro by 2025. This growth stems from a number of initiatives. Of course, in the past, there were already many projects like smart hospitals, paperless hospitals, but so far they are more, they were not connected to each other. They operated more like an island. But now the German government also starts to implement large-scale projects on a nationwide basis. For example, from next year, 2021, every patient will have an electronic health record, which will also be accessible via smartphone. And from 2022, Germany will implement a nationwide system for e-prescription. And this, the telematic infrastructure required for this is already installed in pharmacies, so that eventually all prescriptions will be issued then electronically. But the most interesting development is the implementation of the Digital Care Act, which was passed by the German government in December 2019. Until then, there was no specific pathway for digital health applications to be reimbursed within the national health insurance. But this now changed because the Digital Care Act creates a framework stipulating that health practitioners can prescribe digital health applications in the same way as they can prescribe medicines or physiotherapy. So now doctors can literally prescribe an app. And for developers, this represents a milestone because studies show there are probably already more than 100,000 health apps in the market, but until now it was very difficult to monetize them. Many health apps also are actually for free. But as digital health applications can now be reimbursed within the national health insurance, developer can tap into a potential market of 72 million members of the German national health insurance. That's also, of course, offers interesting perspectives for Australian companies. That's why it's worthwhile to have a closer look at the definition of digital health applications, which in German language are also known by the short version, the abbreviation DiGA. According to the law, a DiGA is an application that relies on digital technologies, which, of course, for example, can be an app that helps to manage a chronic disease, but hardware components are not excluded. For example, the definition also, for example, includes implants fitted with sensors that send data to an app. This app could then, for example, instruct a patient with a new artificial knee joint to avoid certain movements or perform certain exercise. In order to reimburse, an application must be listed in the so-called DiGA directory. So the developers then file an application with the Federal Institute of Medicines and Medical Devices, which in German language is known by its short form BfArM. And in order to get listed in the directory, a digital health application must fulfill two requirements. Firstly, there are general requirements like safety, quality, and also data security. And these requirements are already met if the digital health application has a CE mark. And secondly, a developer has to prove that the digital health application has positive care effects that could, for example, be medical benefits that improve, for example, the physical condition of a patient, but also procedural improvements, for example, increased efficiency in the treatment process of a patient. If those two conditions are met, the BfArM can decide about a listing within 3 months, and then price negotiations for reimbursement can start. But now there also is a new and really somehow revolutionary approach, which is a so-called 12 months trial period or 12 months testing phase. So especially developers of very innovative digital health applications may face the problem that they don't yet have sufficient data to prove the positive care effects. And in this case, the digital health application can now be already listed in the directory on a preliminary basis. So So that means the digital health application can already be reimbursed while the data to prove positive care effects is still being collected. And during this 12 months testing phase, it's then the developer who can even set a price for the reimbursement. However, to be eligible for this testing phase, the developer has, of course, to submit a plausible hypothesis and a time frame for an independent evaluation process. So with this, this new framework for reimbursement for digital health applications is one of the most accommodating in the world, and therefore we will see a multitude of new digital health applications entering the market, and also an increased success rate of digital health solutions. And as the use of digital health solutions becomes more frequent, we will also witness increasing acceptance amongst healthcare providers and patients, which then will also grow the market potential even more. And especially with the new 12 months testing period, there is easier access and much better opportunities for young companies and startups to become part of standard care. So, for example, if Australian startups are interested to explore the German market, they could find support via the network of digital hubs, which is an initiative of the German Ministry for Economic Affairs. There are already 12 digital hubs in Germany, each focused on a specific industry. For digital hubs, for digital health, there is, for example, one hub in Nuremberg, which is also major location for Siemens, which is very active in digital health. And there is a second hub in Mannheim, also focused on digital health. This is also the area where BASF is based, so that's why there is also a focus on digital chemistry. And within this digital hubs, a startup can access ecosystems consisting of potential industry cooperation partners, investors, and funding institutions, as well as research institutions. And startups can, for example, build relationships to existing medtech and pharmaceutical companies in Germany who are maybe interested to complement their product range with digital solutions, and startups could then benefit from the existing distribution channels and customer relations of these companies. So if you're interested to enter the German market, also don't hesitate to contact us. Germany Trade Invest is the investment promotion agency of the German government, and we support international companies that are interested to establish a business presence in Germany, for example, via site selection support. We provide legal information, but also advice on available incentives. We are based also here in Sydney, are always open for questions. I think with this, I can already conclude for today, and I will then hand back to Hannah. And thank you very much.
Wonderful. Thank you, Heiko, for this really great overview of the German healthcare sector and the changing landscape, especially for digital health. Great insights. By that note, I already want to introduce the next speaker, Nick, who will be talking about a project he has been working on at SAP. Thank you, Nick.
Thank you, Hannah. Guten Tag, guten Morgen, depending on where you are. Thank you for joining on. I'm actually going to talk about several projects, and only 3 because I want to make sure that we have plenty of time to go through. So just to give you a bit of insight into some of the interesting concepts and ideas that we're working on at SAP, and some of the great things. So one of the challenges we recognise, and especially, let's be transparent here, the COVID-19 has impacted a lot of us, the way we work, the way we engage, and a lot of the challenges, and this is actually a personal story. So this is actually what happened to us here in ANZ, and ANZ being one of the first regions impacted by COVID-19. We didn't understand, what was happening. where do we go? What can we do? There was a lot of people coming to the office. We'd booked travel to, I was looking actually forward to going to Heidelberg and going to our home office in Waldorf. But we unfortunately had to cancel. All our plans had to be cancelled, obviously because COVID started to grow, and you know, more questions kept coming. Do we still meet with our customers? Do we go into the office? And it was very confusing for a lot of SAP employees. And we thought, well, since we were probably one of the first impacted regions here in APJ, what can we do to help support and make it a bit easier for, I guess, employees to understand where to get the latest information and how to, I guess, communicate with everyone else. So we decided to come up with a solution, and this solution we decided to call Bridget. And Bridget, because what we're looking at is bridging a lot of the technologies and capabilities to provide the information to our employees. And we started off with a chatbot. And maybe what I'll do next, and there's a video here, and the video is actually active on the right here. So, oops, let me go back to the video. So the video, let me start that again. So it's a chatbot, and basically you can start chatting to the bot and ask it different questions. Ask it about the total cases globally. So that was one of the things that we wanted to know. In this instance, I'm asking about the Philippines because we had a huge pharmaceutical provider in the Philippines wanting to know where they should be sending a lot of their information, and hence what we also implemented in there. So we could basically interact with a lot of different organizations and countries. The next thing we could do is then ask questions. So have I been in close contact with anyone? If so, what are the next steps? What should I do? And here what we're doing is we go through a survey, and it takes us through, based on the survey, what we should do regarding medical health. Now, the other information we have here is the ability to look at, and as you can see, I actually recorded this video a while back, so the numbers still looked quite small, and visualize, you know, the challenges and where we're seeing a lot of the problems. And also the ability to kind of integrate the COVID information with you know, operational information. So that was all. I know it was quite a quick video, and I sped it up so I could hopefully have enough time to explain. But for us, this solution, Bridget, is about bringing operational information, so information that we're seeing from the field, information that we're getting from our customers, and having a central bit. Now, we extended the solution, so the next steps here. We worked with a local partner here in Australia called Born Digital. They're an App House partner. And what we can also do is, we also, for the workforce, have wearables. And the reason being, one of the big challenges, or one of the big outbreaks first here in Melbourne, was a meatworks company. And, you know, what they didn't realize, someone had COVID, and before you know it, they spread it amongst all their employees, and that's how that kind of caused the first major outbreak. And so what we did is we worked with a wearable company. This uses Bluetooth technology. It transmits a beacon, and what we were able to do is set up iPads around the different facilities. So the iPads were not only listening to these iBeacons about people who were in the particular warehouse facility, but then also it plays as an information board. So the employees could then come up to this iPad and then ask the questions. You know, I'm not feeling well, or, you know, what's this policy if this happens? Should I be cleaning my hands? How often? They could use the iPad as that. So the iPad played a dual role. And then finally, we had a dashboard. So the dashboard then collected all that information and centralized it. So this is a solution actually we put together in this region. And that's the beauty, I guess, of SAP. SAP has this entrepreneur program where if you have a good idea, they'll support you and fund you and provide you all the capabilities and facilities. And that's basically what we did. So this is something which we rolled out globally. We've also rolled out to customers. Actually, we've made this complimentary, we've made this free. As long as you have SAP software, we've made this available to a lot of our customers. So this has been a great case study for us, and something which we developed. And I think some of the challenges people think of SAP, it took us a long time. We actually developed this within a few weeks using our cloud platform technology. And we're actually agnostic of the SAP backend. So using a lot of our new modern cloud technologies to produce this, to basically, you know, improve safety with employees and our customers as well. So this is a good case study for us moving forward. The next one I'll talk about is what we've done for a hospital. This is Parkland Hospital in the US, and what we were able to do is, again, another place that was being impacted by COVID-19. They needed to know currently how many people were going through the emergency room. They needed to know how much equipment they needed, and what we were able to do is put and create what we call this operational board, and you'll see it in the next clip. And by doing this, I guess people at the hospital were then able to go through the SAP supply chain, identify that they needed more hospital beds, and this is actually a true story. You know, they were really low on hospital beds, and they didn't know where to turn. So they spoke to their person at SAP. SAP has got a solution called Ariba, which is our supply chain network, and they found a vendor, connected them, and then within a few hours were able to send hospital beds to this place to make sure that they had enough bedding for these people coming in. So another great story, which I guess was a result of our technology working together with hospitals. So as you can see here, it's called the grease board, and then they can have a look at the current bed utilization, the current emergency department, seeing what's happening, and also, you know, all the different things. So how many people are being discharged, and refreshing every 3 minutes. So the doctors, the operational staff, the triage staff would know what they could do depending on what was needed, and then they could also interact with other hospitals. So if they were overbooked or over, you know, filled, they could then contact other people and interact with them. The last story, I like this one the best. And again, maybe because I'm a bit of a sports fan, but what this story is about, and depending on who's on the call, you might have seen the movie called Concussion, right? And this movie, and this was an idea. The acronym's called CET, and it's when, you know, obviously people have concussions. Depending on how many concussions they have in a row, you know, you need to be put on the bench, right? Because if not, it could lead to permanent brain damage. What you've just seen there is actually a mouth guard, and what we did is we work with a company called Protec and our partner called Keytree. And what these mouth guards do is, using accelerometers, identify the impact that's being hit, you know, of these rugby players. And what they could tell is, you know, based on this wearable could identify, you know, how much head trauma has happened, and then on the side bench, the coach could basically identify, actually, that's been a significant brain hit. We need to take that player off, else he's going to possibly have permanent brain damage. So we were able to use it, and we were able to track how many brain traumas, and again, use this software. So this was a great story, which together SAP, a hardware company called Protec, and Keytree, and another research institution. And just to give you some insight, they won the 2020 Sports Technology Awards. So this is SAP, you know, traditionally SAP, obviously known as an ERP, but this is us working together with, you know, a few partners to come up with a solution to help reduce brain trauma and you know, brain injuries moving forward. And now the application for this, we've been, you know, contacted by boxers, by wrestling organizations, because again, you know, it's the safety of people is probably the most important. So a great case study. And look, we've got heaps more stories. But what I also want to emphasize is, obviously, being a German company, we are very sensitive about data, fully GDPR compliant. In fact, we were the first certified company globally to be GDPR compliant. And, you know, we are a leader in enterprise technology. So again, any of this kind of data, make sure that it's protected, that it's available, and you know, only visible to people. I've also got a list of different other applications. In Germany, everyone probably has the Corona Warn app, developed by SAP and T-Mobile. And then, look, there's a list of number of apps. We did the repatriation application. So German citizens who were trapped overseas and needed to get back to Germany, it was an SAP application to help bring them back. And again, this is just, again, a small number of things that we've done around the whole COVID response. But I'm going to provide this deck. So if anyone is interested about finding out more, please feel free to you know, use the links in here or contact us, and we're happy to provide that information. So thank you. I hope that was informative, and hopefully I didn't take up too much time. If you have any questions, please feel free, and I'll hand it back to Hannah. Thank you.
Yeah, thank you, Nick, for this very insightful, very diverse projects you've been doing all over the world, award-winning. Really great to see. I'm happy to now hand over to Sylvia already. She will present the case study of a really fast growing startup in the digital health space.
Can I do that screen share? All right, can you see that? Excellent.
Yeah, perfectly, thank you.
Hi everyone, I'm Sylvia Pfeiffer, and yes, I'm German, but I immigrated to Australia in 1999, just before the turn of the century, and somehow never made it back. I worked for the CSIRO, which is Australia's largest research organization, and I did some research in video and audio content analysis, which is now called artificial intelligence, and quite a big field. I did my PhD in Germany and then came on a postdoc to Australia, and worked for CSIRO, then Google and a couple of other technology companies came back to work for CSIRO in 2012 to work on video on the web. And when I say video on the web, I don't just mean YouTube style video, but really video conferencing, the kind of stuff that we're doing now. And that led to us working on telehealth. When I speak about telehealth, I really mean video telehealth, so Videosprechstunde in Germany. And we built a company which we spun out of the CSIRO in 2018, so only basically 2 years old now. But we've become sort of overnight with the COVID crisis, the #1 telehealth software provider in Australia. What that means when I say #1 is in number of consultations. The biggest telehealth company in the world is probably Amwell. That's American Well, the US company. They did 45,000 consultations a day during the COVID crisis. We reached 25,000 consultations a day as a small startup with 7 people in January and now about 35. So I'm pretty proud of what our team has achieved. This is a photo of our offsite from last week. We were in Bowral for the first time in person. Most of these people had never met each other in person, only had met each other over video. And so that was pretty exciting. I started the company together with Nathan, and as I said, spun it out of CSIRO in 2018. And we've also got a GP on our board who's really helping us focus on the clinical use cases that are required to make a telehealth platform different from a plain video conferencing platform. We've got some of the biggest customers that we have are Health Direct, which is well known in Australia for providing health information. They also provide a video call platform to states and the federal government. And through Health Direct, CoView has become the free platform for GPs across all of Australia to use for during the COVID crisis. So in Australia, telehealth was made reimbursable very quickly after the coronavirus crisis hit on the 13th of March. We introduced Medicare reimbursements, and the government decided to give all the GPs a free platform so that they would be encouraged to do video consultations more and keep us separated from each other, which actually I believe strongly has had a positive impact on our dealings with the COVID crisis, and has also helped us from stopping the spread. One thing that the COVID crisis has really shown us is the future of healthcare to be digital. It will definitely move in that direction. The Medicare reimbursements are now available. Patients are demanding telehealth now. They've experienced it during the COVID crisis. They know how easy it is to see a clinician via video or via phone, which is also being reimbursed. I have firm belief that up to 80% of all healthcare consultations will actually be able to be done via video if we put enough effort into it. So obviously not if we just do talking heads, as I call it, but there are lots of digital tools that we can add into the live video consultations that make a video platform, a telehealth platform, and make it a real differentiator from and a real enabler of digital healthcare of the future. So now back to the topic of what's happened in Australia with digital healthcare during the last 9 months. I mentioned temporary healthcare telehealth Medicare items were introduced on the 13th of March. And you can see that in this graph over here. So as soon as in March, the telehealth items came in, telehealth consultations were starting to peak. The little red dots, red points here is the video consultations that were being held, and the gray ones are the phone consultations. So we have pretty good statistics in Australia about the uptake of telehealth. And the purple curve is the curve that shows the in-person consultations. So they have gone down, maybe not as massively as we were hoping, but the number of telehealth consultations has gone up. By October 2020, this year, the Medicare items were extended till March next year, and currently the government is discussing whether we should keep the telehealth items around and considering how to fund this as a permanent telehealth reimbursable items, which, to be honest, will be the start of the digital transformation of healthcare in Australia. Telehealth is an opening door. It is not the end and all of digital transformation of healthcare, but it is a big opening door because it introduces people to using devices. It introduces clinicians to using technology for talking with their patient, for interacting with their patient. And that's a big step and a big change for healthcare practitioners. So I mentioned this already. CoView was the free platform for GP clinics that went through Health Direct and the Australian government. CoView is really simple to use. All you need to do is click on a button. You go to the website of your GP, you click on a button, and you wait in a virtual waiting area. The GP picks you up and you can have your consultation. So we've really focused on making it as simple as possible, which was the reason why when the crisis hit and when Medicare reimbursements were announced on around the 13th of March over here, we suddenly saw a huge increase in usage, and you can just see how quickly uptake grew. We were doing about 400 or 500 consultations a day at the beginning of March, and by April we reached about 25,000. So it's a huge increase. We have heard from our customers, which are healthcare practitioners and healthcare providers, lots of stories about how they were struggling through the crisis. And lots of them actually said that we were saving their practice. They wouldn't have seen enough patients, particularly mental health practitioners, speech pathology. Lots of people were just holding back going to see anyone at all. And a lot of the allied health providers really swapped to doing telehealth, to doing video telehealth online. And we helped them through lots of different functionalities that, admittedly lots of video conferencing and telehealth providers now have, scheduling a waiting area, a check-in section, holding a digital consultations, providing payments. So the ability to take payments from patients was really important for saving practices, but also very important to stick to the regulatory requirements around privacy, patient privacy, and security of the platform. This really explains how we've helped clinicians understand what it means to have a virtual practice. When you transform a healthcare provider who's never done anything in the digital space to an online space, it really helps if you explain that existing processes are not that different when they move into a digital space. So we explained how there is, a waiting area, a consultation room. They have meeting rooms through which they can meet with their peers. Their team can catch up with each other. And there's a schedule on the wall. Really important for them to get that onboarding and that understanding right. Here's a success story also out of a public hospital. So CoView is being used across private practices, smaller businesses, as well as public hospitals. This is Bendigo Health, which is in Victoria. They have an outpatient clinic which supports oncology, rehabilitation, and child health. And in 2017, so only 3 years ago, they did 187 consultations a year via video. So they had a telehealth service offering, but telehealth was not universally accepted. 187 video consultations a year is you know, a small step into telehealth. But through the crisis in April and May, they did 2,700 consultations online. And this was even before the big Victoria shutdown. So the change that's been made to healthcare is substantial. And we can also see that through data. So here's the Medicare data from in comparison between April 2020 and April last year, so 2019. So in 2019, about 1% of healthcare consultations were reimbursed for telehealth. So most of the healthcare consultations were face-to-face consultations. Yet in April 2020, about 35.5% were done via telehealth. So that's a huge difference, a huge change, and it's a huge experiment in picking up digital technology that we couldn't have asked for anything better in digital healthcare, to be honest, to encourage a change of behavior and to encourage patients and clinicians to pick up this technology. Now, having talked about digital transformation a lot, we have to take this with a grain of salt. A lot of the consultations were actually via phone, and the phone I don't regard as a digital transformation. If you just pick up a phone to make a call with the patient, that's something that we've been doing for 150 years. That is not taking us into the digital space. And so analyzing this data in a bit more detail, we found that actually only 5.2% of all the healthcare consultations in 2020 were via video. So that tells me that we're still at the very beginning of our digital transformation journey, even here in Australia and even after the coronavirus crisis. I still believe very firmly that we can reach 80% of all healthcare consultations, that they can be done via video, and that includes GPs, allied health, specialist consultations, so across the board. But we do need to think about the challenges that we encounter in these consultations. So things like measuring the range of motion around a knee or around a joint need to be taken from a protractor like this goniometer here, which is a very traditional instrument, into the digital space. And that's where algorithms such as artificial intelligence and machine learning can come in to help us identify, you know, the core skeleton of a person, and from that calculate the range of motion. There's other applications that are happening. There's respiratory analysis just by coughing into a phone. We've partnered with a company called ResUp for doing this kind of functionality. And then there's monitoring devices and diagnostics devices. I believe that we are also at the beginning of a change here. The only medical device that all of us have at home, I would bet, is a thermometer. Thermometer has been around for such a long time. It needs a couple of partners to take us into the digital space. So an ability to get the heart rate, to monitor your blood flow or things like that, would be really important to get a set of medical devices into everyone's hands. Once we have that, we can actually do much more challenging consultations from the comfort of our home. So what could that look like? Having, you know, up to 80% telehealth consultations, maybe 61.5% will be video, 18.5% the phone, and a smaller percentage face-to-face. That would be the vision for the future. Something that we can try to a difference that we can try to make. It will come with a lot of changes in healthcare. We will diversify the types of consultations that we do. Right now, we go to the doctor for, you know, getting a re-prescription. That's like going to the bank director on your bank just to take out $20 out of your account. It is such a waste of intelligent resources. We need to think differently about how we treat our most important and best developed resources in healthcare. once we're doing this, there's a huge impact that we can achieve, not just in pandemics, natural disasters, or war zones, but across the board, particularly for chronic disease, which has been plaguing us for a while. And Heiko was talking about how we're getting older and older. That's absolutely what's happening across the world, and that brings all the chronic disease. But also for patient convenience, we're all getting used to digital technologies, and the convenience that comes with it needs to enter also in healthcare. So that's really all I wanted to talk about today. I wanted to tell you the story of telehealth in Australia. It is not the only story of digital healthcare in Australia, but it's the one that I've seen most closely and wanted to share with you. So thanks for having me.
Well, thank you, Sylvia. It's great to see how such a useful and much needed application is emerging now, especially through the pandemic, and is becoming much more accessible to people all over, and hopefully for the future as well. I would like to open the floor for questions now. I think we already received one question for you, Sylvia. If there is an opportunity to provide a desktop as a service on the hardware and include that in subscriptions as well.
Something like the prescription software as a medical device prescriptions that are happening in Germany. That's a really interesting piece of information that I wasn't aware of, that this is happening in Germany. So that's a great insight. And yes, medical devices are becoming more diverse. Applications on mobile phones are now called medical devices. So there is an ability, a potential for putting something like CoView on a digital device and placing it at home. Just think about what Alexa is doing. You know, there's Alexas with videos. You could do the same thing, make it into a telehealth device, and just have basically a one-click connection to your GP in your home. This is particularly important for aged care. So yeah, absolutely.
Yeah, thank you. We also have another question for you. So I'm just going to stick with you. So the question is, what is the experience integrating the platform into the workflow of particular GP practices? And does it integrate on data level with the common GP system? So in terms of schedule, patient data, and billing?
So the experience, we are really focusing on the interaction between the patient and the clinician, and as still a very smallish new company, there's a lot of functionality that we're still developing. We have created some integrations with practice management software, but only with cloud-based ones. Most of the existing practice management software that is used by the GP practices across Australia is actually on-premise installed. So integrating with the software that's on-premise as a cloud software is not that trivial. You basically need to install another piece of software in their practice that makes that connection to the cloud. We're working on a lot of these things. I wished I had more developers. I wished I could develop faster. There's so much that we want to do, but it'll take us time.
Okay, thank you. We received some questions in advance as well. So Heiko, I've got one question for you, which is, do applications need to be programmed in German if they want to be applied there, or could it also be in English?
Yeah, the application must be in German. So this framework, which I described for the reimbursement, it's really centered on the patient. So these are applications that are used by the patient. So it doesn't include like systems that are only used, for example, by health practitioners, like AI helping to interpret some radiological image or communication between healthcare practitioners. The center is the patient. And of course, many people in Germany speak English, but others are not that fluent maybe. And Yeah, it's a sensitive area. So in healthcare, you don't want to give room for mistakes, errors, which can have lead to complications. That's why the application itself must be programmed in German. When you look at the process, you can for the application, some documents you file there could be in English, but the software itself must be in German.
Okay, perfect. Thank you. We did have another question for you as well, Heiko, which was, is it mandatory to have the CE mark before the DiGA listing?
Yes, yeah, that's like described in the presentation. It's necessary, but for example, if you have the CE mark, you automatically also fulfill one of the two requirements, but that's the first process that you can start to market the application in Germany, and then the next step is then the reimbursement. So CE mark must come first.
Okay, right, perfect. Thank you so much. We do have another few questions for Sylvia here. A very interesting topic. So next question for you is, how about vulnerable groups and telehealth? So for example, children, elderly, and other. What's your take on that?
So it's actually interesting with telehealth. It's more inclusive than in-person consultations. It's actually easier to take your children to a telehealth doctor than to take them into a practice. It's also easier for an elderly person to click on a button and to see a practitioner than having to organize their family or somebody else to drive them there. So it's actually a positive development for everyone all around, particularly for vulnerable populations.
Okay, perfect, thanks. On to the next one for you. So does the current Medicare benefit schedule rules require a recent face-to-face meeting with a GP? Do you think this will change in the future to open up the GP choice for consumers?
So this is a very interesting question, because our Medicare item rules got changed to restrict the use of what they call pop-up clinics, meaning you're supposed to stay with your existing GP and not pick a random online provider for your telehealth. And the idea behind that is that continuity of care is really important. Your GP should know everything about you. It's the person that you go to when you have some illness, and they have full oversight over everything you do. If you see, 20 different clinicians, every time you have something else, you see a different clinician, nobody has the full oversight, and that gives you worse care. And so that's why they restricted it. I'm not sure I fully agree with that approach. There are certain populations that will find that difficult, particularly if you live in a rural area and your GP lives 5 hours away. You have to basically see them once a year in person just to continue to do telehealth sessions for the rest of the year. I find it's an additional stumbling block, and anything you put in place to restrict the use of telehealth will actually make it harder, and will make people use it less. So I would recommend the government to drop this restriction, but that's just what it is right now, and I can't say whether the government will keep this restriction around or will change it in future. This restriction was obviously requested by the RACGP or one of the doctor associations that wanted to protect their membership, and they're quite adamant that that's the best way to keep the continuity of care alive.
Perfect, thank you. Nick, you already answered this question offline, but I thought I would just open it to the floor as well, so that everyone gets to hear an answer. So there was a question about how hospitals and other healthcare providers are funding requirements to apply the software. Is it a CAPEX or an operational expense?
Yeah, a lot of companies now, obviously because of impacts of finance and everything, so operational expense is kind of the way moving forward. And a lot of our solutions now we're being asked to, and more recently our CEO Christian Klein, you know, he went to the market saying, yeah, our job now is to move everything to the cloud. So that's definitely where we're seeing, and you know, I'm really happy to see what Sylvia's doing. I think that's just amazing work, and you know, I'd love to be able to support something like that, especially because I see the application of wearables, so people, smartwatches. And they're becoming smarter these days, right? Being able to identify trips, being able to identify heart rate and different kinds of things. So I think that's a great market, and you're in a great position there, Sylvia. So kudos to you, and I look forward to you expanding beyond that.
Thanks, Nick. We just had a question in if the record will be available, and yes, you will receive a link to watch it later again. We will make it available on YouTube. We do have time for one more question, which I'm just going to open to all of you to the floor. There's a question about R&D programs specifically targeting e-health. Will this be covered by NHMCR or BTF, or is it already possibly?
I might take this one if nobody else knows the research space. The R&D space in Australia for e-health has been actually pretty good. I know that there's a whole e-health program in Queensland, which you're referring to here, but there's also lots of e-health research happening in the universities, and I'm also aware that NHMRC and BTF are definitely supporting those areas. So yes, there's a lot happening now, particularly as a consequence of COVID.
Okay. One quick last question, actually, again to you, Sylvia. Is it possible to record the telehealth consultations so that both the GP and patient can refer to them later?
If you're asking specifically on CoView, we have that capability, but haven't made it available to our customers at this point in time. It is a big step for a GP to go from not recorded inpatient consultation to a video recorded consultation online. There is a lot of trust and you know, they feel like they have to perform differently suddenly. It restricts them in what they feel they can do. So most GPs actually are not interested in a recording functionality. The way that they take their notes will not change. They can continue to take their notes in their practice management software, and that's really the main way of keeping track of the consultations. So yes, it is a possibility. We require consent both from patients and clinicians in order to do it, which is also really important. But it's not something that a lot of people are asking for.
Yeah, thank you. Thanks to all of you. Thanks for your very interesting questions, great answers. For everyone who still has some questions but didn't have the time to ask them, feel free to connect with any of us. I think our speakers are happy if you just send them an email, connect via LinkedIn. Thank you as well to our partner, GTAI in Germany. And yeah, thank you all. Have a lovely rest of the evening. Have a great day in Germany. And we're hoping to see you again soon at one of our other industry-focused webinars. Thank you all.
Thanks for having us.
Thank you. Thank
Bye.
you for having us. Yep. Bye.
Bye.